The third category we have is acute care. This award will recognise innovative practice within an acute care setting which improves the delivery of services for patients and service users. And the finalists are Central Manchester University Hospitals NHS Foundation Trust with their project NTAG Implementation Team Esophageal Doppler Monitoring in Major Surgery, Aintree University Hospitals NHS Foundation Trust with their Fractured Neck of Femur Project Group, and the University Hospitals South Manchester NHS Foundation Trust with Mandy Bailey and the Infection Prevention and Control Campaign. Let's have a look at these nominations.
The project that I've been involved in has been implementing esophageal Doppler, which is a cardiac output monitor for patients undergoing major surgery. We as anaesthetists have to give intravenous fluid to try and get the fluid balance right. Now if you give too much fluid, the tissues of the body can swell up, which can be a problem for the patient. But equally, if you give too little fluid, the patient becomes dehydrated, and that can become problematic for them, and they can experience complications.
This is one of the Technology Adoption Centre's first projects, and one of the reasons why we were very interested in the implementation of this particular technology was that there was a strong evidence base for this technology for a number of years, yet it was only being utilised in around about 5% of major surgery cases. The approach that we took with regards to this implementation project was to approach three organisations to implement this technology in the routine clinical setting. One of those project sites was Manchester Royal Infirmary. We took a structured, systematic approach to implementation, developing a local project team that was very much clinically led. And the approach was to try and mirror as closely as possible the routine NHS environment.
After we'd implemented the esophageal Doppler and we were using it to help guide intravenous fluid therapy and getting the balance right in fluids for patients having major surgery, we found that for over 200 patients in our hospital, we were able to see a reduction in length of stay of over 3 days. And we were able to achieve this reduction in length of stay because patients experienced less complications following their operation, which is a really good thing for patients, but it's also good for the NHS because by reducing complications and reducing length of stay, the NHS can then save some money, or it can use those beds that the patients would have otherwise occupied to treat more patients. We also found that even though patients were leaving hospital earlier, the numbers who were needed to be readmitted to hospital was actually less. Also, the number of reoperations was reduced. And so we feel that this really secured some extremely good benefits for patients, and it was well worth all the effort of the whole team who were involved in the project.
The main driver behind us setting up the fractured neck of femur length of stay group was that we realised that our length of stay was above average in hip fracture patients of great importance to us as a hospital and department. By empowering the relevant parties, we looked at the whole patient journey and have really improved every single aspect of that journey. It also means we've managed to tighten up on our time to theatre, and we've recently come in the top 3 of getting patients to theatre before 48 hours. So the whole journey for the patient has been improved and hopefully giving them a far better outcome and a brighter future.
Well, the need was to look at the care that we were giving to patients who had a hip fracture, and there had been some concern that we weren't able to prioritise and give them the best care that we felt that they needed. So we wanted to look at developing a unit where that was achievable via the best delivery of care for those patients in terms of planning them, getting them into theatre, getting them out of theatre, getting them back to the level of mobility or close to it as we could possibly do, seeing what interventions the nursing staff needed to improve to do that and get a best outcome for the patient. For the staff and their roles on this unit, it means that they're able to deal with this very vulnerable patient group and their individual needs, identifying what that patient group needs, liaising very closely with their family in a timely fashion in order to be able to mobilise these patients, get them through their surgical procedure, get them back onto a regime of mobilisation and rehabilitation, and getting them back into their own homes wherever possible. The key has been freeing up the staff to be able to give them time to actually do that and work with patients and families, which is what nursing staff want on the unit.
We had a real problem with infection prevention in this hospital, particularly with the number of MRSA bacteremias. We needed to change. We embarked on an ambitious programme which made it everyone's responsibility, supported by really innovative and imaginative communication methods and some very robust performance management of things like cleanliness and hand washing. It energised the hospital, everyone got involved. The net result of that was that MRSAs went down from 26 in 2008-09 to 8 last year, and so far we've only had 2 this year. This is absolutely vital for the patient. Patient care is at the heart of everything we do. It's the central part of what we call the South Manchester Way. So we talk to our patients a lot about the impact. We regularly go around the wards on patient safety walkabouts and ask patients, are staff washing their hands? Do you think that the place is clean? Are we doing everything to make sure that we keep you safe so that their perceptions are taken into account? The feedback we get is overwhelmingly positive on those counts, and patients often comment that people never stop gelling their hands, and that's good to hear. So it just is central to our mission and purpose that we minimise and aim to eliminate hospital-acquired infection. And that's something which we feel we're starting to get right, but we do want to go further, and we do want to eliminate all cases of MRSA.
And the winner of the 2010 Acute Care Award is Central Manchester University Hospital's NHS Foundation Trust with the NTAG implementation team. Congratulations to all at Central Manchester. At this halfway point, let me hand you over to my colleague, John Rutherford from Bolton Council.